Welcome back to the Noon Show, everybody. I'm David Burns, and this is Ask the Expert. And today we welcome Dr. Kurt Schwiesow, glaucoma specialist from Tower Clock Eye Center here in Green Bay. Welcome to the program, Doctor. We're going to talk about the second leading cause of blindness worldwide today, and that is glaucoma. Let's talk about what is glaucoma, and more importantly, how is it diagnosed?
Sure. Well, to start with, glaucoma is a situation where the pressure inside the eye builds to an unsafe level. And if you think of the eyeball like a tiny little balloon, it needs a certain amount of pressure in order to stay inflated, in order to keep its shape and do its job. So a little bit of pressure is fine, but in some instances, the pressure in the eye builds up too high. There's a drain inside the eye that needs to drain fluid in order to keep the pressure at a steady state. So in some patients, that drain doesn't work perfectly and the pressure builds up. Doesn't have to build up much, but if you have an elevated pressure for a long enough period of time, that will start to damage the optic nerve. And that's the nerve that carries images from the eye to the brain. So what will happen is you'll start to lose some of the peripheral vision. That's the vision that's affected first, which is good because then patients with glaucoma are still able to see the important things. They're able to read, they're able to drive, but the problem is patients can develop glaucoma and not know that they have it.
Right. So. Okay. And there's several different treatments, everything from eye drops to surgery, correct?
That's right. There are a lot of treatments out there. I think the most important thing is diagnosis, because with glaucoma, when you lose vision from glaucoma, you can't get it back. So the key to glaucoma treatment really is early diagnosis and intervention. Because glaucoma really doesn't have symptoms early on, it doesn't affect the vision, patients don't feel anything, they don't feel this pressure, it is important to have regular screening examinations, particularly if you're over the age of 50 or if you've got a family member with glaucoma. It's important to get in and make sure that your eye doctor's checked out.
So it's certainly a hereditary issue in many families as well, correct?
It can be, yeah. It does tend to run in families. It's not strictly heritable in the sense that if your parents have it, you've got a 50-50 chance. But we know that half the people with glaucoma in this country don't know that they have it. And we feel that we would find a lot of those patients if we took all our known glaucoma patients and screened their first-degree family members. So mom, dad, brother, sister, people like that.
Okay, awesome. And if you'd like some more information, what is the website for Tower Clock?
The website is www.towerclockeyecenter.com.
Okay, and you'll see the information there on your screen along with the phone number. Or if you'd like to see this segment again, log on to WBAY.com and click on Ask the Expert. Dr. Schwiesow, thank you so much for joining us. We'll be right back with more of the Noon Show right after this.